this week's Cardiology Countdown, we have two studies looking at prevention, one of diabetes, one of DVT, and one look at the supersensitive troponin with very promising results. So beginning at the number 3 spot, we have the so-called ACT NOW trial that looked at patients with glucose intolerance and randomized patients to pioglitazone or placebo. What was seen was a decrease in the conversion over a 2-year period to diabetes with a very slight decrease, 0.04% on the hemoglobin A1C versus a 0.2% progression in these patients. There were also favorable changes on HDL and on carotid intima media thickness with pioglitazone. But there was about a 4-kilo weight gain and a much higher percentage, 12 versus 6%, of patients reporting edema. This was a study of just 600 patients, and so outcomes were not evaluated in a short period, but does suggest that one could slow progression to diabetes with medical treatment. The larger cardiovascular outcome studies of different agents may be helpful in seeing whether that might improve outcomes. At the number 2 spot is a study looking at prevention of DVT in critically ill patients in the medical ICU. This is a group of patients where 2 strategies were compared: regular unfractionated heparin, 5,000 units sub-Q twice a day, or dalteparin, 5,000 units once a day. Overall, there was not a difference in the development of DVT, but a significant difference in pulmonary embolism, 2.4 versus about 1%, 1.3%, and favoring the low molecular weight heparin. I think overall not a significant difference, but one that emphasizes the need to anticoagulate even the medically ill patients in the ICU. But the number 1 spot is a very intriguing study looking at the supersensitive troponin with a very unique study design. This was done in the Royal Infirmary of Edinburgh, where they did a validation of the prognosis of the supersensitive troponin, and then did an implementation phase where they disclosed to the clinicians the new lower troponin values. So that in the validation phase looking at prognosis, they reported a positive troponin only above the old threshold, which was 0.19 nanograms per milliliter. And but they measured to see other patients between 0.05 and 0.19. What they found was that the prognosis of those patients with the new troponin elevations by the supersensitive assay was very poor, with nearly a third having death or MI at 1 year. Now, medical treatment of those patients, when the clinicians didn't know, was pretty modest, with only 20% going to the cath lab and 20 to 30% getting dual antiplatelet therapy. But when the new assay results were disclosed in the implementation phase, the use of angiography and medical therapy doubled, and prognosis was markedly better in the new patients with the disclosed troponin and more aggressive medical and interventional therapy. And so this is a very intriguing study that I think for the first time shows that using the supersensitive troponin and then directing care can lead to significant improvements in outcomes in the ACS patients. And so for this week's Cardiology Countdown, I'm Chris Cannon.